You may have heard of this concept of the social determinants of health. It's this idea that your postal code has more to do with your health outcomes than your genetics or even your behaviors. The Robert Wood Johnson Foundation supported us to do a set of research that we released this spring that looks at what are these major trends from around the world and where is there innovation we can learn from. I'll walk through the 6 trends we uncovered, and importantly, building on what you've already heard this morning, these cross-cutting issues of the role of AI and the role of climate. These trends are interesting on their own, I think, but they get even more interesting when you think about the relationship between each of these. When you think about the relationship between healthy public spaces and housing, multi-generational housing and unpaid care work. So when you start to put these together, you start to find these opportunities for multi-solving where your bang for your buck is pretty undeniable. And my experience working with lots of foundations for the last 25 years is most of them are looking for bang for your buck. There's a lot of data when you think about climate and health that is emerging. There's always been parts of climate that were bad for you. Pollution has been bad for you. We've known that for a long time. But climate change today is different than typical environmental health risks. We need to understand the difference there in order to inform decision makers of what we think is going to be most effective. And then I would say experiment. We'll send you the report. There's a lot of examples from all around the world. And those examples have the kernels of something that can be applied in new places. They won't fit perfectly. Everything needs adaptation to a local context. But there is an idea there that can be championed in many of the places where I believe you want to do work.